So Vietnamese people spend around 17 billion US dollars per year in healthcare. But at the same time, they spend around 4 billion in medical tourism. So the Vietnamese people actually go to Singapore, Japan, and Korea for healthcare as well. Hello, my name is Tuấn Trương, and I'm the co-founder and CEO of Metin47. My background was I was studying in internet computing, and so I'm an engineer myself, and I was working and studying in the UK for 8 years before I came back to Vietnam.
Thank you.
So Metin47 want to be an omni-channel. Metin47 is an omni-channel family doctor network in Vietnam. We provide family care through 3 channels: online through our telehealth app, offline at our chain of clinics, and at home. We are leveraging our technologies to provide a personalized healthcare. We want people to come to Metin47 not because they are sick, but because they want a better healthcare. Yep, we see that telehealth and health tech is a booming trend in Vietnam. We saw a lot of big players like Dr. Anywhere from Singapore, they come to Vietnam. Vietnam we already have GeoHealth, eDoctors. A lot of the traditional players like Medlatech and VMAX and Tâm are moving to the digital healthcare as well. But at the same time, there's a lot of problems and issues and things that need to innovate in healthcare in Vietnam. So we believe there's a strong and a great opportunity for all the startups and all the players to work together in Vietnam. Yeah. So my co-founder, she was working in the bank and in the, media and business before she joined me. And we was close friends for 18 years. So we went to the same high school, same US and UK. And we came back, we did a different job. But at the same time, she was also having children, so she was having a similar experience. And yeah, so that is I have one co-founder. Yeah, our business models we focusing on providing primary healthcare, preventative and well-being to families in Vietnam. 70% of our customer now is pediatrics, moms and babies, and 30% is on internal medicines, on chronic disease. And our business models, we have both the offline at the clinics, and also we're doing online teleconsultations, and we're doing pharmacy, smart pharmacy as well. On our app, our customer can book an appointment to speak to a doctor online through the app, and through the online, the customer can order pharmacy to be delivered to their house, or they can have a subclinical blood test at home, and then the doctors will give the prescription online, or they can book to go to one of our clinics, or they can book a doctor to come to their house as well. We have more than 60,000 users now on the app. Yes, and also we have more than 5,000 visits per month to 6 of our clinics right now. We have 5 clinics in Hanoi and 1 clinic in a city called Thanh Hóa, which is 2 hours away from Hanoi. And we launched Metin47 in 2019. We started with 1 polyclinics, and because there was 2 years for during COVID, so we couldn't grow. But in 2021, we opened our 2nd clinics, and in this year we opened 4 new clinics, so now we have 6 clinics. Yeah. Actually, during the COVID, it helped us to push the telehealth consultations a lot further than we expected. For example, during COVID, our online consultation numbers grow like 100% month on month. So because of a lot of the patients cannot go to clinics, so they turn around and they go onto our app and speak to our doctors. So we saw a strong growth during the pandemics, and it also helped us to educate our patients, our users, to start using telehealth But after the COVID, we see a trend back to normal because people are still prefer face-to-face, but they are more open for telehealth now, and they're willing to try telehealth if they know about the doctors and they know about the service. Yeah. For example, there's only 8 doctors per 10,000 people in Vietnam. If you compare to Singapore, Singapore have around 23 doctors per 10,000 people. Korea probably have more. So Vietnam have a bottleneck of limited resource in terms of doctors, and the Ministry of Health and the government know about that. At the same time, in Vietnam, people are still not there's no primary care, there's no GP in Vietnam yet. So the government is trying to promote family doctors, promote GP, so that it can reduce the pressure for public hospital, for the central hospital. So we see a big trend in applying family doctors and GP in Vietnam, and we believe that if Med24/7 can be the pioneers in helping that, it will be a great future and opportunity for us. Yeah. I was an engineer. I was studying and working in the UK for 8 years before I came back to Vietnam. By 2019, I had my own outsourcing companies doing web and mobile for clients in the US and UK. And by that time, I have my 2-year-old daughter. And the 2 older fathers, right? The daughter is always the best thing happened to any father. So I was always looking after my daughter. And at one point, she was sick for 5 days. And at one night, she was vomiting out blood. So I had rushed her to the hospital. And the doctor diagnosed her with hemophilia, which is a disease that causes the blood not to clot. So we were sent to hemology department for a week. And my whole family was worried because it's a long-term disease and it's going to cost a lot of financial risk, and also I have to worry a lot about that. But after a week, they realized that the diagnosis was wrong, because my family was overuse of antibiotics. Because she was on high temper for 5 days, so we keep using a lot of medications, and it caused her nose to bleed, and the nose to bleed leading to there's a lot of blood in the lungs, and she vomit out blood. But the main problem was that the doctors only had 2 minutes to look after my daughters. And that is actually what happened in a lot of the public hospitals in Vietnam. One doctor typically seeing 100 to 200 patients per night. So they only have 1 or 2 minutes per patient. So it is quite a limited time, and they don't have enough time to ask questions, to understand about the patients. So I was thinking to myself, what can I do to change that? Because our generation will be the one who change the healthcare in Vietnam, right? And we want to do healthcare from the consumer perspective, on how we wanted us to be treated as a patient, right? And how we can improve the health instead of waiting for to be sick to get a better care. So that's why I quit everything and I started Med24/7 with a few of my co-founders. I believe that the Vietnam healthcare market is around 10 to 15 years behind countries like Singapore, developing countries like Korea. Vietnamese people spend around 17 billion US dollars per year in healthcare. But at the same time, they spend around 4 billion in medical tourism. So the Vietnamese people actually go to Singapore, Japan, and Korea for healthcare as well. Yep. Again, because of the market, the doctors also doesn't have enough time and training in soft skill. Vietnamese doctors are actually quite good on the medical expertise, but because they serve so many patients and there's not an efficient system in place. So and the consumer behaviors, they tend to try treat themselves. So they go to the pharmacies and ask for the drugs without seeking for doctor's advice. And they wait until it's quite sick and they go straight to see the specialist. People also need to have more education on how to take care of your health, right? And also the doctor and nurses need to get a good environment where they can focusing on their medical expertise. In Vietnam healthcare market, there's problems on the supply and also on the demand as well. There's a great opportunities for investment in healthcare in Vietnam. At the same time, the economic of Vietnam is growing. GDP of Vietnam is growing. As you can see, Samsung moved to Vietnam, right? And Apple and a lot of the big players are moving to Vietnam. So people are actually having a better life. So they request a better healthcare as well. So the demand is there. The biggest problem is the bottleneck is the limited numbers of doctors. So we always have to optimize on our clinics, optimize on our resource so that doctors can have more patients. And also we are trying to training our nurses, our other medical staff to train the mindset of the traditional support so that they can help the patient better. On the patient side, we also try to educate and give them better mindset in terms of look after the healthcare. They should go do checkup earlier. They just should care about the healthcare before they get sick. So what we're trying to do is actually turning sick care into healthcare. We call Vietnam right now still sick care. People are sick and they care. It should be healthcare. In Vietnam, telehealth is still something quite new. So even the policymakers and the Ministry of Health also trying to work on the policies and guidelines to help support with that. At the same time, there's a fragmented distribution of doctors. So normally on the best doctor, the good doctors are in big cities like Hanoi and Ho Chi Minh cities. When in the smaller city or province, the patient, the customer doesn't have access to a really good healthcare. Yeah. So the difficulty is how you can maintain the good standard and have to keep a good standard and good quality of care to the patient, no matter where the location is. And at the same time, because the policy and the guideline is also under development. So sometimes it's difficult to understand or knowing exactly what to do. I think, as I mentioned to you, the Ministry of Health knowing about the bottlenecks of resources and the reason that on the public hospital, the public clinics are overcrowded because the lower level, the commune levels or the district level, the province level is not that good in standard yet. So a lot of people go straight to the public hospital, the big hospital, and so the underlying solution is that you have to improve the lower level, right? The commune level and the district level to have a better standards that people start going to. Yeah. We was lucky enough that we got the investment from 2019 from KK Fund and other investor when when our company was not set up yet. So we got the funding before we actually setting up the company ourselves. So it was just the idea and the community we have, and so at the beginning it's quite fortunate. However, after 1 year, COVID hit, right? So we got 2 years that we had to turn around and do a lot of different business and service so that we can still growing. Because offline clinic were not able to operate at that time. But fortunate enough, beginning of last year, we got the series investment from Antaras, Pavilion Capital, East Ventures, and Mauritius. We are still growing. There's a lot of difficulties and challenges, but I believe that it's a good impact. That if we can keep growing, there's a lot of investment into healthcare. So there's a couple of stories, right? During COVID, when there was one patient, he was living in the rural areas, and one night she was in really serious illness, and his family was he got a mental health problem. So he was getting crazy, and the family didn't know how to handle. So one of his relatives living in Hanoi post on the forums on Facebook asking for help, and we managed to connect the patient to one of our doctors. So the doctor was seeing him online and managed to calm him down so that he's get better. and the next day the family could buy medications to help support the patient. So during COVID, that's one of the stories that the family was really happy and thanks us to help with that. So we see a lot of stories where we could help our patients who couldn't get access to healthcare to manage to get access. So those are the stories that push us through all the difficulties and challenges that we have. I think Vietnam startup is still in early stage comparing to Singapore or Indonesia or Korea. However, despite the recession in globally, Vietnam GDP is still growing. A lot of the big players are moving to Vietnam, like Samsung and Apple, and so on. And at the same time, Vietnam is at the golden age of labor force. With the economic is growing, the demand for life is also growing, and also the people are expect a better lifestyle. So I think there's a lot of rooms for startups to have solve all the problems. I see that also a lot of investors coming from Japan, Korea, and Singapore are coming to Vietnam as well. So I believe right now is a good time for startup in Vietnam. So our vision and our dream is that every family in Vietnam should have a 24/7 doctors. So should have a family doctors for every family in Vietnam. That's our long term, why we exist, why we are here. But in terms of the next 11 or 15 years, we want to create a largest network of doctors and nurses where they are given the full ecosystem to provide family doctors preventative and well-being for all the families. We also want to build an academy where we can help train the doctors and the nurses so that they can better at their works. And at the same time, we want to provide technologies to help monitor the healthcare so that the healthcare can be personalized and people can look after the health with the more IoT device, monitoring device. And we are expect to grow our chain of clinics across Vietnam as well.